I'm going to briefly go over the skill validation for administering oral medications. These are the basic things that you need to know when you come to test out for this skill. The things that you want for supplies is your MAR, your Cardex, and your chart. And I'm going to say that I'm going to be giving the 9 o'clock medications. And I'm at the nurse's station and I'm looking at the meds. The one thing I do want to take note is the PRNs. Has this person been receiving pain medications? Have they been receiving them every 3 to 4 hours? You might anticipate that they will be needing them. Let's say they got it at 9 o'clock and it's noon now and they've been receiving them directly every 3 hours. You might anticipate it and go ahead and bring them in with you to offer them to your patient. So the first thing also I want to do is check my physician's orders to see if there's any new orders and what the ongoing orders have been. Next, I want to get my Cardex, go to the medication portion of it, and get my MAR. And what you're doing is comparing to making sure that the Cardex and the MAR completely match up, word for word, time for time, route for route. You're checking your 5 routes, your dose, route, patient, amount, and time. Those are the 5 rights that you are checking. So you just go across. If there's any discrepancies, you've got to determine, how can I find out which is right? Is the Cardex right or is the MAR right? The way you need to do that is just go back to the chart. Look at what the physician ordered. So there are some things that you can clarify with pharmacy, so you could go ahead and call them. So I've gone down through my list. I've checked any PRNs that they may need. The next thing I would do is on the bottom, it says shift verification. That's what I sign, saying that yes, I have indeed done this. I've done my shift verification. A lot of times your MARs are on the computer. We're just going to do it on paper just for this video. So I've signed that. I'm going to be giving my 9 o'clock medications. I go over to the Pixis. This is our simulated little Pixis. To know what drawer your particular medication is in, there is a chart on each side of the Pixis saying where the medication is. So, get their medication. And I'm making sure again that I've got the 5 rights. And this is my second check. So the 5 rights, make sure they're all correct. Then I want to make sure, is there any dosage calculations that I need to do? You know, are they not matching up? If am I supposed to give 2.5 milligrams and what I have is 5 milligrams, then I would need to split. If I need to split, crush, pour, anything of that sort, I would go ahead and go back to the nurse's station and do that. But for this validation, I'm going to say that everything I have here is correct. So then I can go directly to the patient's room, leaving everything intact. I will have my cup that I need, but I want to make sure I leave them in the containers. So I've done 2 checks. Now I'm at the patient's bedside. First thing I want to do is make sure I have the right patient, checking the armband, checking to make sure there's no allergies to anything that you're going to be giving him. He can say his birth date back to me just as a second check. Now I'm going to do my 3rd check. Again, I just line them right up and I make sure the 5 rights, are they all matching up? And you can just tell me what the 5 rights are and if they're matching up. Any drug calculations that you did back at the nurse's station. Then what I could do is ask the patient if they want to take all the medications at once or if they want to take them one at a time. And he wants to do them one at a time. So I'm going to say, okay, now I've got your Cardizem. That's for your heart. And I would open it up and get the medication ready. One thing I know is that for some of these medications, you have to have the appropriate vital signs. So I'm either going to know before I go in there, what was his blood pressure? What was his pulse? Because I've done that with my assessment. So make sure you know their vital signs. Make sure you know all the lab values that are needed to know for these medications. Do you have to know what their white blood count was? Do you have to know what their hemoglobin was? What their pro time, their prothrombin time? Know all their labs. Know why this patient is getting these medications. So then you have to know their history. What type of surgery did they have done? What type of history do they have? What type of condition do they have that they're in the hospital? All that information will be on the Cardex. So just make sure you know it and look all the information up, because we'll be asking questions about that. I would open up all my medications, or one at a time. I would go ahead and make sure I've got water, give him his one pill, and then he takes it. And I would keep doing that for each pill that he needs for at 9 o'clock. The other thing I could do is then again ask him how he's feeling, if he needs any type of PRN medications. Does he need his inhaler? Does he need any of them? You noted these before you went in so that you could be more prepared, but you can also do an assessment afterwards. Sometimes they don't know that if they have a pain level of 5, they should take something for pain. So make sure that you check with the patient on any additional PRNs. See if they're due for it, if they indeed can have it. I think that pretty much sums everything up. After I've given the medications again, I would chart right away that I gave them and that he took them and that he didn't hold them in his mouth. He swallowed them and there were no complications. So I've charted, and then if I were to chart on the computer, I'd go do that right now. So that completes the skill.